Measuring using a rigid cystoscope. To ensure accurate measurement of the prostatic urethra, the penis must be held in a fixed position. When the cystoscope has reached the bladder neck, place the first peg on the cystoscope at the end of the penis. Withdraw the cystoscope until the tip is between the verumontanum and external sphincter. Place the second peg on the cystoscope at the end of the penis. Use the ruler from the measurement kit to measure the distance between the two pegs, from one leading edge to the next leading edge. Measure the prostatic urethra repeatedly until two similar measurements are obtained. Determine the right Memokath length, rigid cystoscope plus 10 mm. Gently loosen the black securing nut at the end of the insertion system. Replace the mandrel inside the insertion system with the optic from a rigid cystoscope. Push until it is almost at the end of the insertion system and only 1 to 2 Memokath coils are still visible. Gently lock the black securing nut at the end of the insertion system. Replace the white cap on the red side port on the insertion system. Attach the extension tube here. Replace the white cap on the blue side port on the insertion system. Attach the tube for irrigation fluid here. Lubricate and fill plenty with gel in the urethra just before inserting the Memokath. Do not open irrigation fluid before the Memokath is inside the urethra. Insert the Memokath as if it was one-way street. Don't pull the Memokath in the reverse direction. Advance the Memokath slowly through the urethra and stop 2 to 3 mm before the bladder neck. When the hot fluid is attached to the extension tube, slowly advance the Memokath until you are exactly at the bladder neck. Don't advance the Memokath into the bladder. Flush 50 ml, 55 degrees Celsius sterile fluid through the extension tube. When the fluid reaches the Memokath, the distal end of the Memokath will expand. Gently loosen the black securing nut. Pull the optic back inside the insertion system until the optic is distal to the Memokath. Gently retract the optic back inside the insertion system until the optic is distal to the Memokath. Check that the Memokath is released from the insertion system under direct vision. Verify that the Memokath is in the correct position by advancing the optic up to the distal part of the Memokath. The Memokath expansion should be exactly proximal to the external sphincter. For further instructions, consult Instruction for Use.